Hari from 92.7 Big FM, and actually have with me today a doctor to talk about something जिसके बारे में मैंने ज़्यादा discussions होते हुए तो नहीं सुने. So firstly, let me welcome on the show Dr. Jayesh. Hi doctor, कैसे हो आप?
Hi listeners. Namaskar to one and all.
डॉक्टर मेरा पहला क्वेश्चन आपसे कि ये दिस बिट ऑफ डूइंग इंटरव्यूज लाइक दिस ऑन थ्रू वीडियोस एंड ऑन गूगल मीट एंड जूम, ये आपको कितना ज्यादा चैलेंजिंग लग रहा है?
It's actually turning out to be very interesting and I would say very friendly because schedule are not so tight. You can do it at your ease and in your known environments and all. So I think all in all this might be a way to go. It eases out everything, so this is a good thing which is happening. Something good coming out of Corona effect of the pandemic.
Right. आप और ज़्यादा I think technically you're becoming more tech savvy.
Yeah, that is one thing true, but you are easily able to connect to the people you want to connect and convey the things. And I think as we keep on using it, most of us will get disciplined to take our turns and have a proper fruitful meeting. To begin with, it was all chaos, but now I believe that gradually people are settling down, and maybe this may be the way to go ahead in future, much more than what it was before ever.
Right. But doctor, how have you been? How has 2020 been for you? हम कहते हैं कि आप सारे doctors हमारे लिए, you are our frontline COVID warriors. I'm sure 2020 has been quite challenging for you.
Definitely challenging, but at the same time, I usually feel that I try to take, what positives I take from a negative situation like this. And it taught us many things like, you can you can bring down your necessities to bare minimal. So all those things which I wanted X, Y, Z in, general sense has cut down and gone down to so many less things. So you are able to survive well in so many less of the things, less of the avenues in every aspect, social, behavioral, professional, and all those things. Of course, it has been tough for most of us because total life has changed and a lot of health problems. And specifically for those who are not having COVID, because so much of attention has been paid on COVID, that those people who are not affected by it but need medical treatment for other reasons did suffer initially, but now most of us have regrouped and we have tried to isolate ourselves, people treating with COVID, people treating not with COVID, and those not treating with COVID, we try to cater all other patients. So hopefully now patients are not having much of trouble seeking treatment for non-COVID issues, maybe of any specialty.
Right. Okay, so doctor, like how I started by saying कि आज हम ऐसे टॉपिक पर डिस्कशन करने वाले जिसके बारे में मैंने होते हुए नहीं देखे हैं और ना ही सुने हैं. We're going to talk about prostate cancer. So before that, I would actually want you to share for our listeners what is prostate and exactly how does it affect males?
Well, to begin with, I would start on a positive note. I often say that no cancer is good to have. But if God gives me a choice and says that you have to choose one cancer for yourself as a male, I will definitely choose prostate cancer. And as we discuss forward, we'll come to know why. Now, just to understand, the two kidneys keep on producing 24/7 urine continuously. Now, this urine is stored in a bag called a urinary bladder, from where the urine is ultimately thrown out of the body through a tube, which we call it as urethra. Now, in males, this urethra passes through a gland, which we call it as a granthi in Hindi, which is a walnut shape and is called as prostate. Now, this prostate has got two components, two parts, a larger part in the center or the inner core and an outer cover, which is very small or very thin. This has got two different portions and both have their own importance. The inner part, which increases with age, especially after 40 or 45, and is non-cancerous, as it increases in age, it may press the urinary passage and may produce blockage of urine and troubles related to blockage of urine, like, a male might have to go more frequently to pass urine, the urinary stream might become less, he might have to strain and so on and so forth. Now, this non-cancerous growth is called as BPH, means benign prostatic hypertrophy. Whereas the outer cover, from where most of the cancers of prostate arise, Since it is away from the urinary passage, it does not obstruct, does not cause any urinary symptoms in its early stages. And hence, early prostate cancers do not produce any symptoms. This is the punchline which I want everybody to, register, that early prostate cancers do not produce any symptoms.
Okay, right. But ये जो problem है doctor, ये कितनी common है? I mean, how common is it and why does it actually occur?
प्रोस्टेट कैंसर बहुत ही कॉमन चीज है. अगर हम देखें तो दिस इज द सेकंड मोस्ट कॉमन कैंसर इन मेल्स वर्ल्ड वाइड. वेस्टर्न कंट्रीज, जो डेवलप कंट्रीज हम बोलते हैं, वहां पे ये एटलीस्ट 5 to 10 टाइम्स ज्यादा कॉमन है इंडिया और अदर एशियन कंट्रीज से. द चांसेस ऑफ अ पर्सन हैविंग कैंसर इंक्रीजेस जैसे एज द एज एडवांसेस. So when we consider a male above 65 years of age, almost 30 to 60% of people may have a prostate cancer. Now, as common, जैसा बहुत सारे cancers में हमने देखा है कि exact reason cancer of prostate क्यों होता है is not known. However, diets which are rich in animal fat may increase the chances of having cancer, whereas diets which are rich in fruits and vegetables may actually decrease the chances. This is just hypothecation. ये एक तरह से सोचा जा रहा है. Although prostate cancer is not hereditary, like जिसको हम हिंदी में अनुवांशिक कहते हैं, one which runs in the family, but एक important चीज ये है कि those patients who have diagnosed to have prostate cancer before the age of 50 years, in their family, their close relatives like brothers, son are more likely to have cancer, and that's why they should be checked quite early for prostate cancer.
Right. But do you think डॉक्टर इसके बारे में जो अवेयरनेस है वो कम है, जो डिस्कशन होते हैं इसके अराउंड वो कम होते हैं?
You are right. इसके बारे में अवेयरनेस और डिस्कशंस कम है. दे आर बिकॉज ऑफ मेनली 2 things. एक तो ये है कि जैसा मैंने कहा, इट डज नॉट प्रोड्यूस एनी सिम्टम्स. कोई इंडिकेशन, साइन सिम्टम्स या कोई तरह की ट्रबल्स अर्ली केसेस में नहीं पाई जाती, एक बात होती है. और दूसरा है कि ये कैंसर, जैसा मैंने कहा था शुरुआत में, कि एक अच्छा कैंसर है. कोई कैंसर अच्छा नहीं होता, बट कंपैरेटिवली एज कंपेयर टू अदर कैंसर्स, बिकॉज इसकी ट्रीटमेंट और ट्रीटमेंट रिलेटेड साइड इफेक्ट्स काफी कम है और ट्रीटमेंट के रिजल्ट्स काफी अच्छे हैं. सो दिस इज प्रोबेबली द रीजन. बट एट द सेम टाइम आई वुड से कि जो कैंसर इजीली कंट्रोल हो सकता है, अच्छे से क्योर हो सकता है, we should try and create awareness so that more and more people are picked up and they are cured of this problem.
Right. But doctor, you're saying कि इसके कोई symptoms नहीं होते, कोई indications नहीं होते, तो फिर इसको diagnose कैसे किया जाता है?
जैसा कि हमने कहा था कि because it arises from the outer cover of the prostate, तो कोई early symptoms नहीं होते. Symptoms तभी आते हैं when this prostate has advanced, when this cancer of the prostate is advanced. It has gone beyond prostate, like कुछ urinary symptoms, कुछ bone pains, जोड़ों में पेन या फ्रैक्चर्स, और कुछ ऐसे सिम्टम्स जो कि कैंसर के प्रोस्टेट से बाहर निकल के बाकी सिस्टम में फैल जाने से होते हैं. सो बेसिकली डायग्नोसिस, खास करके अर्ली डायग्नोसिस नाउ, दैट्स व्हाई इट वुड डिपेंड ऑन 2 things. First is checking all the males who have urinary symptoms above the age of 40 or 45 for cancer prostate. और दूसरा होता है, which is quite increasingly being used, is checking all patients who are asymptomatic, जिन्हें कोई ट्रबल नहीं है, कोई सिम्टम्स नहीं है, आफ्टर द एज ऑफ 50. बिकॉज दिस चेकिंग इज वेरी सिंपल. One small annual blood test called as serum PSA, that is prostate specific antigen, should be done. And if there is some problem in that, yes, further testing can be done.
Right. ऐसा भी होता है क्या डॉक्टर कि इसके लिए कुछ, I mean, this happens in males of specific age group, or is it like what is the age criteria?
As we have addressed before, that prostate cancer usually occurs after the age of 50. और जैसे जैसे उम्र बढ़ती है, chances of a person having cancer becomes more. Now, how do we diagnose this thing is that the diagnosis is in a very stepwise manner. एक के बाद एक. First and foremost, सबसे ज्यादा जरूरी examination by a subject specialist, which we call it as urologist, and this will include a small examination through the motion passage, that is called as transrectal examination, and a blood test which is called as serum PSA, that is prostate specific antigen.
Right.
Now, if we have any doubt on these parameters, we'll just finish off this much part. If we have any doubts on these parameters, then only the next step comes. And what is the next step is prostatic biopsy of the prostate with the help of sonography, or MRI, magnetic resonance imaging, and sonography together. Now, if we have detected cancer on this biopsy, then the next step comes where we have to determine, जहां हमें पता करना होता है कि कैंसर अभी भी केवल प्रोस्टेट में ही रिस्ट्रिक्टेड है या प्रोस्टेट से बाहर आ गया है. बिकॉज ट्रीटमेंट लार्जली डिपेंड्स ऑन ये दोनों डिफरेंशिएशन पे कि प्रोस्टेट में ही लिमिटेड है या बाहर आ गया. ये पता करने के लिए कि क्या कैंसर प्रोस्टेट के बाहर गया हुआ है नहीं, देयर आर वेरी सिंपल टेस्ट अवेलेबल, मेनली डिपेंडिंग ऑन सीटी स्कैन और MRI एंड सर्टन ब्लड टेस्ट, और कुछ लोगों में पेट स्कैन मे बी ऑल्सो हेल्पफुल. Here we would just like to know about this very wonderful cancer marker. We call it as cancer marker, matlab a simple test which can tell us that yes, we have to check further this fellow for cancer. So this cancer marker for prostate is serum PSA, that is prostate specific antigen. It is produced by the prostate and it can increase in two conditions. Especially this is very relevant in Asian countries and India, jahan pe cancer prostate के साथ साथ infection of prostate is also very common. So it increases in two conditions. एक तो कैंसर प्रोस्टेट हुआ और दूसरा इन्फेक्शन ऑफ द प्रोस्टेट, दैट इज कॉल्ड एज प्रोस्टेटाइटिस. लेकिन इंपॉर्टेंट थिंग टू नोट अबाउट प्रोस्टेटाइटिस इज कि एक बार उसे हमने एंटीबायोटिक्स और कुछ मेडिसिन से ट्रीट कर लिया तो ये PSA कुछ ही वीक्स में नॉर्मल हो जाता है. So that is the biggest differentiation between cancer of the prostate and prostatitis.
Right. ये तो about diagnosis and about detection. But when it comes to treatment, उसके बारे में आप क्या कहना चाहोगे? How is this actually treated and monitored?
So once we have diagnosed, we determine two things. ये prostate से ही में ही सीमित है, is it limited to the prostate या prostate के बाहर गया हुआ है? Now जिन patients में cancer is limited to the prostate, it is highly curable by a surgery called as radical prostatectomy, जहां actually पूरा prostate along with its cover निकाल लिया जाता है. Now it can be done in many ways, like an open surgery traditionally जहां पे हम कट करके करते हैं, या laparoscopy जहां हम की होल से करते हैं, or a robotic surgery nowadays, which is a part of laparoscopy only instead of standing there and operating with the instruments through the hole, a person sits on a console like a game, your video game, and then the instruments are moved through the video. So this way the radical prostatectomy is very good curative treatment for prostate cancer. Whereas in patients where the prostate has advanced beyond the prostate, there also the treatment is very good available. The first line of treatment जिसे हम कहते हैं is a hormonal treatment. Now what is this hormonal treatment is? Prostate cancer increase होता है on a hormone, male hormone called as testosterone, जो कि हमारे टेस्टिस या अंडकोश जिसे हिंदी में कहा जाता है उस पे ग्रो करता है. सो देयर आर वेरियस इंजेक्शंस और टैबलेट्स जो ये हार्मोन को सप्रेस करती है, प्रोडक्शन कम करती है, उसको इफेक्टिव नहीं रहने देती है. सो फर्स्ट लाइन ऑफ ट्रीटमेंट इज दिस हार्मोनल ट्रीटमेंट. अगर ये फेल होती है और या फिर एडिक्वेट रिस्पॉन्स नहीं मिलता है, then we go to the next line of treatment which is called as chemotherapy, and in some patients we may require radiotherapy for some kind of bone pains या कोई कैंसर जब बोन्स में फैल जाता है तो in some cases we may require that. This treatment is also applicable for those patients जिनमें की prostate cancer early stage में ही है but they are not fit for surgery. So this is the way we take the treatment for early and late cancer prostates.
Right. Two last things, doctor. One is there actually a way to prevent this?
A very good question, but unfortunately, like in majority of cancers, there is no way to prevent prostate cancer because basically we don't know why it occurs. And since we don't know why it occurs, we can't prevent it really. But as I said, if we keep on following the patients who are likely to have it, like as I said, people are above 50 who have symptoms of passing urine and all, if they are checked for cancer, and those above 50, if they are checked for cancer, then you can have a lot of early diagnosis and good treatment and hence a very good result.
Right. Superb. Additional advice or any message that you would like to actually give out for our listeners, doctor?
I would like our listeners to remember 2 or 3 important things. One is that prostate cancer is very common, although as you said, the awareness is not so much. So it's on us, all the doctor fraternity, to increase the awareness along with people like you in the media. Second good news is that it is highly curable when it is checked in, when it is detected in early stages, and even in late stages, there are good treatment options available with minimal side effects. So all in all, prostate cancer picture is very good, and we all should make an attempt to create an awareness and then treat it early.
Awesome. एक आखिरी क्वेश्चन मेरा डॉक्टर जो मैं आई हैव बीन वांटिंग टू आस्क दिस टू यू राइट फ्रॉम द बिगिनिंग ऑफ दिस सेशन, पर मैंने सोचा मैं इसको एंड के लिए सेव करती हूँ. Where are you right now? Are you in office or at home?
No, I am in my daughter's room.
Yeah, so I'm
You could see the picture.
जो
That's my
पिक्चर
daughter.
दिख रही है वो किसकी पिक्चर है?
This is my audiovisual room, because once you are in hospital, you keep on getting patients here and there, and it becomes a bit difficult to, dedicate time and free mind.
Right. Amazing. Thank you so much, doctor, for your time and for sharing such
we had a
wonderful insight.
Hope we can keep on doing this awareness things in future also.
Absolutely. Thank you, doctor.
Thank you so much. Thank you.
Two.